And so I became a student here at Tennessee Technology Center then. And honestly, it was the best choice that I ever could have made because it really changed my life.
You've got to learn a lot of things that are not what you're wanting to be in the end. Like
Yes.
you've got to do clinicals in, many
Learn
different
how to
fields.
Tuck bed sheets. You have to learn how to do all the bedside nursing things, different areas of nursing that, don't ultimately have much to do with your anesthesia practice. But yes,
Right.
It's a in-game kind of thing. You got to keep your eye on the prize at the end to get to that ultimate goal.
Full circle moment now is you now get to teach this program.
I
You now
know.
get to be involved in the future nurses as they come through. That's really neat.
Sort of like a dream come true, honestly.
Welcome to TennTalks. Today we're talking about a career that is everywhere. In your hometown clinic, your regional hospital, your neighbor's living room, and in some of the most critical moments of a person's life. We're talking about nursing. And if you think nursing is just one job, think again. It's an LPN in a nursing home, a CRNA putting someone to sleep for surgery, a corrections nurse, a hospice nurse, a home health nurse, and it is one of the most in-demand and flexible career paths Tennessee has to offer. Today, you'll hear from Autumn Bentley, a practical nursing instructor at TCAT Elizabethton who started as a CNA, dropped out of college, built her way back, and now teaches the same LPN program that changed her life. And you'll hear from Kelsey Markle, a young woman from Parsons, Tennessee, who made a plan in high school to become a CRNA and is about to graduate from Union University this summer on schedule. These are stories about servant hearts, long roads, and what it looks like to build a career that matters to your community. Let's get into it. Our first guest has lived every step of the nursing journey she now teaches. Autumn Bentley grew up with a servant heart, the kind of person who always wanted to help. She watched hospice nurses care for her grandmother at the end of her life and never forgot it. After a detour through college, a CNA program, a move to Tennessee, and a few years out of school after getting married, she found her way to TCAT Elizabethton, then called Tennessee Technology Center, and says it was the best decision she ever made. Today, she's back at that same school as a practical nursing instructor, training the next generation of LPNs in the very program that changed her life. Please welcome Autumn Bentley.
My name is Autumn Bentley, practical nursing instructor here at TCAT Elizabethton. I got into nursing, I think, because I have always, what I call, have a servant heart. I've always really loved helping other people. Even as a small child, I loved helping other people in my classroom. I was always wanting to help the teacher. I've always helped people in general. As I got a little older, my grandmother ended up with cancer and it had spread across her body. And we had hospice nurses that came in to take care of her in the home. And as she was on her deathbed, basically, and I saw how helpful they were to her and to my family. And so maybe that kind of sparked an interest. So whenever I went to high school, we had I did go to a very rural high school, so we didn't have some of the programs that some other high schools have, but we did have like medical terminology, and so I took those courses, and I think that's where nursing kind of got introduced to me.
Gotcha. Was around high school?
Yes.
Very cool. Very cool. When you started your nursing journey, what was your first level of education that you went to after high school?
So after high school, I actually went to a 4-year university where I thought I wanted to be a pre-med major. I know. It didn't really pan out for me, and so I ended up going back home, and I did a CNA class at a local community college. And so that's where I really started in my nursing career, was as a CNA at a nursing home.
Oh, very cool. Now, CNA, how long does that certification take?
So at that place that I did it, that local community college, it was a 3-month program.
3-month program. Okay. You dip your feet into CNA. How do we get from CNA to you're here teaching practical nursing?
Yes. So I worked as a CNA for a couple of years at a nursing home, and I actually wanted to go back to school to be a nurse. And so my then fiance, actually, we were going to school together, and I ended up dropping out of school because we wanted to get married. And so I was actually out of school for a few years. Fast forward to, we moved to Tennessee. And I always still wanted to go back to be a nurse, and I found TCAT, actually, and so I became a student here. Back then it was called Tennessee Technology Center.
I remember that, TTC.
Yes, it
That's
was
right.
TTC, and so I became a student here at Tennessee Technology Center then, and honestly, it was the best choice that I ever could have made, because it really changed my life, honestly.
That's
So-
awesome. And the degree you got there at TTC, now TCAT, was
Yes.
licensed practical nurse, LPN?
It was, yes.
Okay. Was it a 12-month program?
It was a 12-month program.
Which it still
then.
is now?
It is still now, yes.
Okay. Fantastic. So
Yes.
the full circle moment now is you now get to teach this program.
I
You now
know.
get to be involved in the future nurses as they come through. That's
Absolutely.
really neat.
It's like sort of like a dream come true, honestly.
Yeah. As we think, oh my gosh, I can't imagine trying to squeeze an LPN program into a year because you guys cover so much. How
Yes,
does that
we do.
day-to-day look like when it comes to trying to balance the classwork side, but also
Mm-hmm.
the practical side? I mean, I think we today have pulled you out of a simulation lab, right? So what does
Right.
that day-to-day balance look like?
Yes, so it's a lot of scheduling for sure.
Mm-hmm.
Our students at this location, we do 4 days a week instead of 5. There are other TCATs that do 5 days a week, so we have a little bit of a longer day. So typically, we try to split up lecture versus skills. Today happened to be a skills day, but there are days that there are lecture days where we will spend all day in the classroom. Of course, there are multiple breaks, and we try to, do some activities and have fun, play games, that sort of thing. But there has to be some content that's delivered. And then we have other days where we have skills days, like we had simulation lab today, where once they learn the skills, they really get to go in a real world situation and practice the skills that they've learned in the classroom.
What is some of the coolest hands-on things they get to do?
So I think today was probably a really good learning experience for some of my students, because they were taking care of a patient that was post-op surgery from a total knee replacement. The patient really needed some pain medication. And as we were giving this pain medication, we made a dosage calculation that was an error.
Ooh.
And so we actually, yes, so the students did give too much of a medication, and so they got to perform CPR today on their patient. So, but they get to give injections. We've hung IV fluids today.
Oh, wow.
We've obviously performed CPR today. We've administered reversal agents for the error that they did make. So there's been a lot of learning today, for sure.
A lot of thinking on the feet. Like, I mean, it's an actual exercise. Like, it can
Absolutely.
go off the rails.
It totally is dependent on what interventions that they do for their patient. So every simulation is different.
Okay. What does the job market look like right now for nurses?
Hot.
Hot? I imagine it's been hot since COVID, right?
Oh, absolutely. I know in our area, we really need nurses, and I know that's across the state, both in, rural and city areas for sure, need nurses so much. I know that even in our small area here in Northeast Tennessee, they have increased the pay rates for nurses, particularly since COVID, just to try to draw people in, because we are obviously a smaller area versus, our larger areas. So we have seen that our regional places have really started to ramp up the pay to try to draw those nurses in.
What are some of the places you're seeing your LPNs go work after they complete their program?
Oh my goodness, there's so many avenues that you can do in nursing. We just had a cohort that graduated in December, and so far I've heard back from some of those students. We've had students go into corrections,
Wow.
like correctional nursing. We've had students that are going to home health, nursing homes, hospice, at the hospital, at the local hospitals. I mean, honestly, it's across the whole area. There's just pretty much anywhere. Clinics, doctors' offices, everywhere.
Wow. I mean, I definitely could have named clinics and hospitals off the top of my head, but I
Yeah.
wouldn't have got to corrections without your help. That's really neat that's available out there as an opportunity. What about some of the earning potential? What could they expect to see?
So in our area, it definitely varies based on what specialty you go in, like corrections versus clinics would be different, or hospital versus a clinic would be different. But in general, I would say, probably $20 per hour would be kind of starting range, depending on where you go. Whereas if you go to these very specialized area, like specifically correctionals facilities, I know that we had a student that actually just reached out to me and said they are starting at $31 an hour.
Oh, wow.
I know. So it's really, across the span. It totally depends on what area that they're in, like what area of nursing. And then also, if they choose to work full-time or part-time, PRN, there's many options there as well.
PRN, LPN does sound like that's a mouthful. I don't know. I'm not sure I could get those initials in the right order every time.
As needed. How about that?
That's right. But that's really neat, though, to think, it's really, you get to make a few choices that really determine what area of nursing, salary range you're looking at. I'm sure hours, vary wildly between each job. If you're looking for something more stable, maybe a clinic. If you're if you like to travel, there's those options as well. That's really neat.
Yeah.
I'm sure you guys see high school students that come and tour and things like that. What are some skills that you're telling high school students, like if they're interested in this career field? What skills or classes are you telling them that they should really be investing their time in?
Most of our local high schools have like HOSAs, which are like the Future Healthcare Professionals groups. So I definitely tell them to get plugged in with them, because not only do they introduce them to nursing, that they'll introduce them to like respiratory therapy and all kinds of other areas as well. Certified medical assistant, phlebotomy. They'll plug them into all kinds of different areas of healthcare to try to get them to figure out, what is it really that I want to do in healthcare. So that's a great option for a lot of our students, is to get plugged into HOSA. But also, again, some of our high schools also have just simple medical terminology classes or basic nursing classes, that sort of thing, so they can do like their CNA at the high school level.
Yeah, that way they get to dip their foot in a little bit. I mean, get to see, if that's kind of the right temperament for them.
Yes, and our most recent development is we have in our area is called Ballad Health Academy, and so our regional healthcare system is actually enrolling students dual enrollment as a pre-practical nursing student.
Oh, wow.
Yes, and
that's fantastic. So they can start on some of the, I'm sure, the classwork side, or is it both?
Yes, so they'll start with the classwork side and start to learn some of those skills, and even get to do their first clinical experience while they're still in high school.
Wow.
Yeah.
It's so great to see dual enrollment getting utilized in every field. That's so neat.
Yes.
What are some of the biggest challenges that you're seeing in the nursing field right now? This could be you. This could be you personally in your line of work, or it could be just what you see as students leave.
I think that nursing is an ever-changing field, for one. So there's always change that's occurring in healthcare and nursing, no matter what field that you go in. And so I think that students really have to be very flexible with, every day, whatever you do today, specifically for this policy, tomorrow it may be different, because we may have decided this is today's best practice versus yesterday's.
We may have learned something new between then and there.
Absolutely. So it's an ever-changing field for sure. So flexibility, absolutely. And then I also think that because we are so shorthanded, like we need nurses so bad, I do feel like our students and those that have graduated, they are constantly being asked, hey, can you come in extra to help us out? So I think that there are some area hospitals in particular that are asking for like mandatory overtime. So that can be that's a lot for a student, especially a new person that's just graduated. Like, okay, I don't really know what I'm doing yet, but y'all come in extra.
For sure.
Yeah.
What do you think is some of the biggest rewards in your field?
I think that we really get to touch the patient when they are at their lowest. For the most part, whenever someone's seeking health care, they're usually sick, their family member's sick, and we really have the opportunity to make a huge difference in that patient's and their family's lives. I have my teaching partner, Melissa. She will say that you will always be using your therapeutic communication. And that's true, because not only are we taking care of the patient, but if your patient is, even if they're in ICU and they're sedated, we're taking care of the family members also. So I think that being able to, even though someone may be at their lowest, being able to care for them and help them and see them hopefully get better, that's absolutely a reward for being there for them during that time.
How do you see technology changing nursing? I mean, just even in the career that you've had so far versus where it could go in the future.
So technology has really changed nursing a lot. And when I first started as an LPN, I worked at a nursing home and we had paper everything. If you go to the same facility that I worked at newly now, there's probably not any paper. Everything is on a computer, which is helpful for sure because we have such great information at our fingertips. But the most recent changes that I've seen have been some AI-assisted virtual nurses at a facility that I worked at. They had an AI assistant that whenever you needed like a second nurse to verify something, instead of physically and going to find another nurse, then there was an AI, like a camera in the room, and it would zoom in to whatever medication that you were giving, and it would provide the second verification that you didn't have to have a second human. You could just use the virtual assistant AI.
Wow.
Yeah.
That is crazy to see that already being implemented. I mean, because we feel like AI just got here. I mean, I know it's been here a minute, but wow, that's crazy to see it already being implemented and changing lives like that. What would you say to a student who's worried about not being smart enough for nursing? You know, they expressed interest in, the healthcare field, and maybe they didn't score the highest on their ACT, or they struggled in some classes, and, there's always that one adult you wish didn't talk to your student that told them, oh, you won't make it. What do you tell those students that have come face to face with that?
In my experience in teaching, if a student or a person wants to be a nurse and they have compassion for other people, I can teach you the book stuff. Okay. I can't, it's much harder for me to try to teach compassion than it is for me to teach, this is how you do a dosage calculation. I can teach that all day, but for me to try to teach someone, no, you have to actually care about your patients, that's a little more difficult. So if we have a student that is compassionate and caring and they really want this, we will spend the extra time to help them, tutor them, whatever we need to get them there, because those are the ones that make the best nurses.
I love that. So it's not really, for a student not feeling like that feels like intelligence is the thing holding them back, to be able to tell them that would never be the thing that holds you back here. What would hold you back is if you don't care enough about your patient. Like if you don't have that, which I think all the nursing instructors I've talked to do such a great job of explaining that really early on, to say like, this is a passion field. Like you do this because you're an essential part of your community, helping them. And so if you're not here to help, kind of get out of the way, I guess is the best way to tell them.
I mean, sort of, yes, because if you don't care about your patient, then you're not going to care about, oh, well, I have this medication that's scheduled at this time to make sure that I give them, or I won't care to, check them to see if they have enough output every hour or all those things. You have to actually, care about these patients and care about the humans that you're taking care of.
That's right. I have a couple rapid fire questions, if that's okay.
Sure.
And so they'll sound like they're not rapid fire, but just the first thing that comes to your mind will be fine.
Okay. I'll do my best.
What is the biggest lesson that you've learned so far in nursing?
To never be surprised.
I bet that is a great lesson to learn.
Never be surprised.
Do you have any stories that don't break HIPAA that you can tell us that made you realize that was something important?
Sure. I honestly have a few, but so I had a patient that was admitted. I was working in ICU at the time, and I went to assess them. I had gotten a report from the other nurse, and I went to assess the patient. She had a central line, a triple lumen central line in her subclavian. So I went over to make sure that everything was, all the drips that they told me this patient was on, that it was all correct, because that's what you do, trust but verify. I preach that to my students. So I go over to check on the patient, and when I do, I notice that one of her medications is backing up in that line, and that's strange. That's not normal. It should flow into the patient, not back out of the patient. And So I go over there and I'm like, I'm not sure what's happening with this. So I flush it with a flush. And so I noticed that blood then starts backing up into my flush and in a pulsating manner. And I'm like, this is strange. I think this might be in an artery instead of a vein. And so I called the intensivist and I said, hey, I'm worried that this triple lumen line is actually in an artery instead of a vein. He's like, no, it's impossible.
Impossible. Always the word.
I looked at the x-ray myself and I was like, okay, just wanted to throw that out there. So then I decided that I would actually hook it up like an art line to see if I got a reading.
Mm-hmm.
And I did.
Oh, no.
And so I called him back and I was like, hey, I just want to let you know that I'm pretty sure this is in an artery.
I have a reading.
Yes, like I actually have a blood pressure from this art line. And so that was, I probably shouldn't have been surprised that could happen, but I mean, it's impossible, he said.
It's impossible.
Yeah.
It's always the beginning of the story right before it gets turned possible is it was impossible.
Yes.
Say the same thing about the Titanic. What do you think is the best piece of advice that you've gotten so far?
I think the best piece of advice that I have received from, I'll say mentors, is that as long as you are caring for your patient, don't worry about basically anything else. Don't worry if you're worried that the doctor's going to yell at you when you call them, or don't worry if someone else is saying, hey, you could do this differently. But if you are taking care of your patient and you're making decisions based on their care, you're being their advocate. And so I think that's probably the best piece of advice I've received.
I think so too. That sounds great. The last thing I wanted to cover before we go get to check out some of these simulation labs at home is I know we talked about the job market in Tennessee for LPNs. We talked about some of the starting salaries.
Mm-hmm.
And there are wonderful lifelong careers that you can have as an LPN. But I also know you probably have a lot of students that use this as maybe their first step of nursing.
Mm-hmm.
And then, because this is, correct me if I'm wrong, a highly transferable degree that can go into RN, I guess?
Yeah, absolutely. And that's actually what I did as a student. I was an LPN from this program, and then I went on to a community college and did what we call a bridge program.
Okay.
So you can bridge from LPN to your associate degree RN. So that's what I did. And then if you want to further from that, from your associate degree RN, you can go for your bachelor's degree, still an RN. And so I also did that. I went to university to get my bachelor's degree as an RN. Now, past that, if you want to continue, you certainly can. You can go from your bachelor's degree RN and you can go get your master's. And as the master's degree prepared nurse, you can choose to do like nurse practitioner. You can even choose like a CRNA, which is a certified registered nurse anesthetist, where you like administer anesthesia during surgery. There are many options with a master's psychiatric mental health nurse practitioner. So there's lots of options for nurse practitioners and also master's level nurses. And then past that, there's a doctorate of nurse practitioner as well, so a DNP also.
Wow.
So it definitely can build on. Can just be the first stepping stone.
Right. This does not have to be the end of the story if they want. Now, it can be because we've already talked about there are wonderful jobs out there that pay enough to support you and a family that you can get right out of this 12-month program.
Correct.
When they transfer, how long does it take to do the RN bridge program if they look at a community college level? So
if they go to a community college, we actually have TCAT has an articulation agreement with most of the other community colleges, and so they actually get some prior credit for their LPN.
Oh, wonderful.
And so typically, if they want to do the bridge program, they usually start in the summer term, and they go summer, fall, and spring, and they graduate. So it's usually another 12 months.
Wow.
I know.
Wow. I mean, almost like you didn't miss a beat. Because, if they did the 2-year program, that's 2 years, and
exactly.
So they could be working if they needed to be working fast. I know we have some students, a lot are first generation. Some of them need to work as quickly out of high school as possible. And so one of my students did that. She did an LPN, went to work, and then was starting starting those steps. I think her end goal was BSN.
Yes.
But yeah, she went to
Yeah.
program to program. So it's
Yeah.
really neat.
I have former students that are now nurse practitioners.
Wow.
That have just, they just kept going. They go from LPN, they go get their RN, they go get their BSN, and then they go get their, master's nurse practitioner. So, yeah,
Wow.
absolutely.
Awesome. Well, I appreciate you so much sitting down and taking a moment out of the labs to talk to us.
For sure. Thank you.
Autumn showed us that the path into nursing doesn't have to be straight, and that compassion matters more than a perfect academic record. Now we're going to hear from someone who made her plan early, stuck to it through every obstacle, including a global pandemic, and is about to cross the finish line. Kelsey Markle is from Parsons, Tennessee, a small rural community in West Tennessee where her family has deep roots. She mapped out her path to become a CRNA, a certified registered nurse anesthetist at 15 years old. And this July, she will graduate from Union University's CRNA program right on schedule. She is exactly who Autumn is teaching toward. Please welcome Kelsey Markle.
My name is Kelsey Markle. I'm from Parsons, Tennessee. I'm currently a full-time student at Union University in the CRNA program, which is Certified Registered Nurse Anesthetist, and I will graduate in July of this year, so July of 2026.
So you are in the heat of it right now.
Correct.
And that last,
And
it last semester or is summer technically
Summer's
last semester?
technically the last semester.
But we're not going to do that
But
to you.
we're-
We'll count spring. We'll say that this is it.
This is the home stretch
Exactly.
right here.
We're far enough into the spring where we
Correct.
can say you're in the last semester. That is amazing. Could not pronounce that A word to save my life. So I'm really glad that you did that for us.
That's all right.
When you were younger, what did you want to be?
So originally I wanted to be a vet.
Okay.
Completely different world.
Still medical.
Yeah. Yes.
Okay.
Correct.
Okay.
And funny enough, one of my teachers in school now is a retired vet, so it all ties back together.
That's right.
But I wanted to be a vet. Then I decided that anesthesia was pretty cool. And I got to look into careers. To be an anesthesiologist, of course, you have to go to medical school.
Mm-hmm.
But to be a nurse anesthetist, you have to become a nurse first.
Okay.
So it's kind of a more patient-centered approach, and you get to do a lot of the same things as an anesthesiologist, depending on the area that you work in. Specifically, rural areas, CRNAs have more autonomy and independence.
Mm-hmm.
There's a lot of CRNA independent practices in this area in West Tennessee, actually.
Oh, interesting. I would not have known that.
Yeah. So I just kind of, which I'm a very early decider of things. So in high school, you can ask Bree, I was thinking about these things when I was 15 years old. So I made a plan in high school, and somehow I've actually stuck to it. So here I am 10 years after high school graduation, finally coming to fruition with all of these plans.
Wow. So you committed to the long haul, the long game.
Yes.
Because, like you said, in order to be a CRNA, you obviously have to be a nurse first.
Correct.
Which means, and this might be hard for some students to grasp, you've got to learn a lot of things that are not what you're wanting to be in the end. Like
Yes.
you've got to do clinicals in, many
Learn
different
how to
fields.
Tuck bed sheets. You have to learn how to do all the bedside nursing things, different areas of nursing that, don't ultimately have much to do with your anesthesia practice. But yes,
Right.
it's a in-game kind of thing. You got to keep your eye on the prize at the end to get to that ultimate goal.
Wow. Now, where did you go to nursing school?
So I went to UNA, North Alabama, in Florence, Alabama. I graduated in December of 2019, so I graduated just in time for the COVID pandemic to hit.
Oh, my gosh.
I was a new grad nurse. I started nursing after I passed my boards in February of 2020, so that was a interesting experience.
Passed boards in February. We shut down the world in March.
Exactly. I barely knew how to start an IV, and I was having to take care of COVID patients at the time, so I had to learn really quickly. It was a good experience, lots of interesting times in the hospital, things that were not normal happening. So,
Right.
yeah, that was a wild time.
Well, before we jump into that, because obviously I have so many questions about that. But what made you choose UNA? So, like, when you looked at nursing programs around, was there something about UNA or their specific nursing program, the city of Florence?
So, at the time, truthfully, they had some really good scholarships. Was one of my
That's right.
big interests because
That's
I
right.
knew long term, going to spend a lot of money on education. So, but UNA was great. I don't ever regret for a minute going there. I loved it. I was kind of looking for something that was a little bit smaller feel. I looked at Knoxville. A lot of people for me. So
Understand.
coming from Parsons, we're smaller town, very much smaller town. So Florence seemed like a big city for me at the time. It was about an hour and a half away, so it was great distance. Could come home if I needed to. Could stay gone if I needed to. I remember sitting in a big group of people, and everyone was talking about their experiences and why they chose Florence and stuff like at orientation. I was like, I wanted to come to the big city, and everybody laughed at me because they all thought Florence was a small town compared to Birmingham and Huntsville. So that's how I landed up at UNA, but Florence is a great city right on the river, so kind of similar to Parsons in that aspect. And I actually ended up staying there and working after nursing. They have a great nursing program. They have like the highest pass or boards pass rate for the state of Alabama.
Very nice.
So that was
Very nice. So you stayed in Florence. You loved the big city.
Loved
after
it.
you got
Yes,
done.
the big city.
They
had 3 Walmarts. It was a big
Oh
city.
my gosh. Yes, my grandmother's actually from Florence, and they added a Walmart near where she lives. And
Yes.
so and now they've got the coffee shops. I think I went to Dutch Bros last time I was
they
there. I
have
was like,
Dutch Bros
look at
and
you.
Seven Brews.
So they are a big
They
city
got it
now.
all.
They get to
Right.
claim it now. They may not in 2018,
2016
2017. They
is when I
may
went
not
there,
have been
yes.
able to say it, but they definitely have claim
But
to it
yes.
now.
So
What would you say is the hardest adjustment? But that maybe not in your college classes, but when you got to enter nursing school at UNA, what was the toughest adjustment you had to make?
So as far as starting just like your prereqs at UNA, I would say it was just a big adjustment coming from like high school where you didn't have to study, all that much. You kind of
Right.
get by and stuff, and then you get to college and you're like, wow, I've actually got to do a little bit. But I will say what I was really glad I did was dual credits. That, of course, AIRS helped foster that relationship with
That's
the
right.
Parsons Center out here. I took some through UT Martin Parsons, so that
Very
was,
nice.
I feel like that really helped my transition.
How many
doing
credits
that.
do you think you got in dual credit in high
I
school?
had 24 when I graduated.
24 credits?
Uh-huh.
That's 2 semesters.
Yeah.
So that really, did you get to start nursing school early?
Yes, 1 semester early. I could have done it a whole year early, but I was too scared to take too many hours when I got to
No,
actual
I understand.
college.
No, I understand.
So
Wow.
I graduated in 3.5 years with my BSN.
Now, was there a time when you were in the nursing program that you were like, I'm not doing this, or I'm quitting, I'm changing majors? Like,
There were some nursing. Well, I never finished the story I was telling earlier. So prereqs, was different. Then you got to nursing school and you really had to study. Like you had
that's right.
to live at the library a little bit. The night before a test, you weren't sleeping, you were studying, which I was also trying to be involved in student government and sorority and all the things of that nature. But yes, so nursing school, it was, you see the memes and it's like, you have 4 pumpkins. Which one's the most orange? That is true. That is how nursing school tests are. Very much so. So nursing school tests for a different animal to figure out, even from your science, like chemistry and biology prereqs, because it was very like, you might have 3 right answers, but which one's the most right?
the most right.
So
It's
that
always
was-
what got me.
That was difficult.
What's something you wish you knew before starting college?
I wish I would have known that it would all be worth it in the end, which I guess I kind of did, but because I'd met a lot of nurses, obviously, that like their job. Then you meet people who don't like their job, but it was all worth it, and it ultimately worked out to get me to where I am now. So
right.
I
That's
wish I
right.
would have known that I would have, made it this far, because I never expected to even actually get into
You were
nursing
just taking
school.
a
It was
day at a
one
time.
step at a time.
That's right. That's right. Which I think is a great approach too, though. Like it's to know that it's worth it back then,
Yeah.
but to also take it in this day. Because if you had known this journey is going to take
Oh yeah,
this many years, it might be overwhelming.
Oh, yeah.
And so it's really awesome to see.
it's
starting
definitely
to
a
get
big
here.
commitment. Oh yes,
Yeah.
looking back now, I'm like, wow, I've done a lot of things.
Now, after you graduated, what field of nursing did you go into?
So I originally started on a critical care step-down unit.
Okay.
So we took patients from the CVICU, cardiovascular ICU, and the regular ICU after they were, deemed not critical enough to be in the ICU, but they didn't need to go just to like a regular floor yet. So we were kind of
Right.
in between. I did about 6 months there. Then I went to the CVICU where I took patients straight out of the OR after open heart surgery, big vascular procedures, things like that.
And so obviously ORs and things are very strict anyway.
Oh, yeah.
How was that adjustment knowing that this was in the heat of COVID?
So we actually, when I first started, so of course you have an orientation period and you take all these fresh surgeries coming out, knowing what to do, this and that. Well, I guess it was November of 2020 when I was in there. At one point they had kind of canceled all elective surgeries but due to COVID.
Right.
People weren't coming to the hospital. There was nothing going. It was really a wild time. Like there was days when there would be hardly any patients. Nurses were getting called off very frequently because everybody was scared to come to the hospital at first. So it was kind of a ghost town for a while. But then we ran into the issue of surgeries definitely picked back up because people put off going to the
them
doctor,
off.
going to the
Oh.
hospital,
Yeah.
and people were really needing them. A lot of people with COVID, blood clots afterwards was a big thing. So we had a vascular surgeon. We got a lot of those patients, removing clots post-COVID, things like that. So it really picked up. But for my first month or two of orientation was that time period when nobody was coming to the hospital. So
Right.
it was kind of, we just did a little of this, a little of that. And then after everything picked up, I got a real good orientation.
Oh, I bet. Now, what would you say is the part of your former job and your former nursing life before this that you would say surprises people the most? Like if you told them about it, they would go, oh, I never thought of that.
I guess the fact that so in my unit, we were very autonomous. We had a lot of protocols we worked on. Like we could actually, like if the patient's blood pressure was low, we had, protocols. We would start medications to help bring their blood pressure up, vasoactive medications, which has in turn helped me now.
That's
since
right.
I managed them in the OR. But another thing is that we had protocols and we could wean the patient off the ventilator, which most people life support think of, and then we were the ones actually able to get them off the ventilator after the surgery, wean their settings down. We'd have a respiratory therapist come in just in case anything happened, but we were the ones to get them off of the ventilator after surgery.
Wow.
So that was kind of a neat experience. Again, has helped me in my career now.
That's right, and also surprising.
Yeah.
What would you say was the most challenging part of your work?
For me, it was definitely during COVID when so a lot of nurses had left our hospital to go travel nurse because a lot of money in it at that time.
Yeah.
So we were very, very short. And most of the time in the ICU, you take, especially if you have a fresh patient out of the ICU or out of the OR, you take one patient. But a lot of times we were ending up with 2 and 3 at that time because there was no nurses and there was things going on. So that was definitely tough. Being understaffed during COVID, that was a tough time.
What would you say is the most rewarding part?
Seeing the patients coming out of the OR with all these lines, monitors, things attached to them, all these medicines going, and then getting to wheel them out to the step-down unit. And they get to get up in the chair the next morning, eat their breakfast, call their loved ones. So that was really cool to truly see that process from they come out with all these, life-supporting devices, and then you get to get them up to the chair the next morning if all goes according to plan. So that's really a full circle 12-hour shift right there.
Oh, I bet. Because that is, oh my gosh.
Yeah, that was a very rewarding part of our ICU, especially after COVID. We didn't have, a lot of times there wasn't always positive outcomes during COVID. We all know that. So really when we got back to just doing surgeries and getting people out of the OR, getting up to the chair the next morning, getting them walking, that was really a rewarding time. That's why I loved working in CVICU because our surgical patients typically did really well after surgery.
Neat. Very neat. Well, looking at high school and college, what skills were the most important for someone in your career?
I would definitely say communication is a huge one and preparedness.
Interesting. I expected you to say something science related, but I guess that's more of just the theory of it.
Yes.
When the rubber meets the road.
Yes.
You mentioned you had some autonomous things that you guys could work through, but really you guys are still a team. There's still a lot of very important communication that has to happen there.
A big part of bedside nursing, as well as what I'm doing now in the OR with anesthesia, is communication. You have to, as a bedside nurse, you got to communicate with your doctors, with your PAs and nurse practitioners, what's going on, because you're the eyes on the patient at the time. So you've got to communicate what you're seeing. So that's a large problem with healthcare in this country as a whole. We're a little bit reactive rather than proactive.
Right.
So if nurses, have the eyes and the ability and the means to be proactive, it helps a lot. So that communication is where that comes into. And then preparedness, I would say, is definitely more part of what I'm doing now with anesthesia. You got to expect anything to happen. You got to be prepared. If their blood pressure drops, you got to fix it. If their blood pressure spikes, you got to fix it.
Just thinking quick
if
on
they're
your feet.
bleeding, you got to give them blood, things like that. So.
Very interesting. What would you say that school prepared you for really well in nursing school?
Nursing school, well, charting, I guess, would be a good one.
Okay,
we learn a lot about charting, paperwork, because that's a large part of your job. As far as a lot of the other things, honestly, it was a lot of on-the-job learning.
What was the most surprising thing you had to learn on the job that you were like, oh, nursing school did not tell me about this?
A lot of it. Honestly, a lot of it, especially with COVID, because nobody was expecting that in fall of 2019 to happen, spring of 2019 or 2020. So a lot of it was on the job, just kind of figuring things out, because, of course, you read the textbook, and it's not always what happens in real life.
Right.
I would say that really holds to be true with nursing. And anesthesia, textbook does come into play a little bit more than nursing did as far as starting IVs and all things like that. That's right.
You're hopefully in a lot more control in this environment. What does career growth look like in your industry? So in nursing, we've always heard it's a nursing shortage. Is that something you're still seeing?
Oh, yes, especially post-COVID, because COVID drove a lot of nurses to not want to be in nursing anymore, not want to be at the bedside specifically. So, yes, there is a large nursing shortage. I would say growth for nurses, you have lots of different avenues. You can do what I'm doing. You can go into an advanced practice degree such as CRNA, nurse practitioner. There's different avenues for that, or, management's a route. Some people like to do managerial positions. There's the something called a chief nursing officer in the hospital, and that's always a nurse, of course, and he or she is over all of the nurses in the hospital.
Okay.
So there's lots of different avenues for growth. As far as where I'm at now, about to hopefully become a CRNA after I pass boards this summer.
That's right.
You can get into management. There are positions such as chief CRNA.
Okay.
There are some CRNAs who get into management at the hospital, like corporate level. So there's lots of avenues to continue to grow.
Now, of those avenues, what is the most attractive to you? What do you see yourself in the next 5 to 10 years after acing these boards this summer?
So I hope to stay somewhere in West Tennessee. I'm very interested in rural healthcare, rural access to healthcare, things like that. I'm hoping to find a job somewhere in the West Tennessee area. I don't see myself getting into management. That's not really me, I don't think. I don't really want to take on that role. Yes, I just want to be able to come and do my job.
Right.
Now we do have something that I hope to do one day is be like a resource for students. So what I am right now is an SRNA student registered nurse anesthetist.
Okay.
And at all of our clinical sites, we have a clinical coordinator who coordinates our schedule, gets us there appropriately, things like that. So I wouldn't mind to do that and, be able to place students with their preceptors for the day, make sure they have a good day, make sure they're okay. You can check in on them, things like that.
While still getting to be
a nurse anesthetist.
That's
correct.
Right. Well, so you're getting kind of the best of both worlds,
Correct.
leading the next generation while still getting to do what you call to do.
That's something I would be interested in doing, like helping students, but I don't really see myself in management.
Now, what has drawn you to rural healthcare?
I guess growing up in a rural area, such as Parsons, all of my family's here. My family was here like when the town of Parsons started. So we've all been here for a really long time. And just growing up in this environment, I think it's a great place to raise a family. I'm still in contact with most of my high school friends. We text, talk every day. That just environment gives you a sense of community, and I think the same withstands in rural healthcare. Smaller hospitals, you have a sense of community in your hospital, whereas at bigger facilities, you don't really get to know who you're working with. You don't know the surgeons that well, but at smaller facilities, you get to have more of a meaningful relationship. Also, being around here, I know it's hard for people to get to the doctor sometimes, especially like Nashville. I know it's not that far away, but some people don't have the means. So
right.
I think it's important that we continue to try to provide access to rural healthcare.
Now, with you having such a long educational journey, who were some of the adults that spoke into your life at that time, and who helped you the most along the way?
Oh, I will definitely give a shout out to Bree with the Ayers Foundation on the front end. She helped me get everything going on the front end as far as paperwork, applying to UNA, things like that. So that's very ground zero. Actually, whenever I got back into school, so I had been out for almost 4 years whenever I started CRNA school, and I had to call her up, like, how do I do this FAFSA again? Can you help? And of course she did. She helped me along the way a lot, and really connections are a huge thing, I would say. So I was in a sorority at UNA Alpha Gam, and an alumni of my sorority was a recruiter at the hospital I ended up working at. So that was a huge connection to have to help me get into the CVICU eventually, which I needed that ICU experience to get into CRNA school. Okay, and also, while I was in CRNA school, we had to do nursing school. We had to do a leadership clinical, and you could pick, like, if you wanted to be with a manager, if you wanted to be with a nurse practitioner, just any type of leadership nursing role, pick CRNA. Well, I ended up with a CRNA at my hospital, and he helped me get my shadowing hours when I was applying to school, and I've done some clinical rotations there. Helped me out a lot. So connections really matter and help you along the way. So connections are important. But there's been a lot of people to help me. I can't, attribute everything to one person, because
there's
been a lot of steps along the way. It's a journey. It's been a long journey. But I'm fortunate to have a lot of good people.
So would you say that's the best advice for a high school student to get to where you are? That not just pass AP 1 and 2, but also communication, connections, getting ready to work on a team,
yes.
Putting yourself out there, making those calls, trying to get that internship.
If I had to talk to myself in high school right now, I'd probably say, make a plan and stick to it, which I have for the most part. You have to have 1 to 2 years in the ICU before you can apply to CRNA school. So COVID delayed mine a little bit. I was there more like 3.5 years, but that's okay. I would say, make a plan, stick to it. It's a long journey, but if you stick to your end goal and stay prepared, keep your grades up. You have to keep your grades up in high school to get into nursing school. You have to keep your grades up in nursing school to get into CRNA school. You have to get your certifications, but things like that, you just got to stay motivated.
That's right. Take it one day at a time.
It's a marathon, not a race.
That's right. Well, I have a couple rapid fire questions for you, and they seem like bigger questions, but I promise we'll get them knocked out. First, what was your favorite part of your job?
Now I would say it is that we get to meet these patients, pre-op them very quickly, and you have to gain their trust in a 5-minute period to, for them to trust you to put them to sleep. So that's my favorite part now. And so you have to really build that relationship very quickly.
Very quickly. So you got to be really efficient.
So you don't get to meet them long before you're taking the OR and putting them to sleep.
What would you say is the biggest lesson you've learned so far?
Stay humble. Never get an ego. Stay humble and have humility. Be willing to take constructive criticism, learn from it, pivot, move forward.
And then what's the best advice you've ever received?
Something else I've learned, and this kind of does sort of relate to what I've done. You don't know what you don't know. So
that's right.
You don't know what other people are always going through. People don't know what you're going through.
That's right.
You don't know what you don't know. So always keep that in mind.
And stay humble.
That's right. Stay humble.
Well, thank you so much for coming in and joining us today.
Thank you for having me.
From a woman who found her calling watching hospice nurses care for her grandmother, built her way back through a CNA program and an LPN degree, and now teaches the next generation at TCAT Elizabethton, to a young woman from Parsons, Tennessee, who made a plan at 15 to become a CRNA and never let go of it. Today's guest proved that nursing is not just a career, it's a calling. Autumn reminded us that compassion can't be taught, and if you have it, there's a place for you in this field no matter where you started or how long it took you to get there. Kelsey showed us that a plan, persistence, and the right connections can take you from a rural Tennessee high school all the way to the operating room. If you're a student who has ever wanted to help people, really help them, at their most vulnerable moments, today's guest, we're talking directly to you. Nursing is hiring everywhere in Tennessee. The pay is growing and the pathways are flexible. You can start with a 12-month LPN program and build from there as far as you want to go. Thank you to Autumn Bentley and Kelsey Markle for sharing your time and your stories. And thank you for listening to TennTalks. See you in the next one.
Tennessee.